Introducing our presenters, we have the Jennifers. We have Dr. Jennifer Schwartz, she, her. She is the James F. Short Professor of Sociology at Washington State University and current holder of the Elma Ryan Bornander Honors Distinguished Chair. As a criminologist, she conducts statistical analyses of community crime patterns and trends. Her published research on violence, drugs, and alcohol, fraud, and white-collar crime has been supported by federal grants from National Institute of Justice and National Institute of Health, and featured on National Public Radio, Freakonomics, and in news sources such as LA Times, Chicago Tribune, and Wall Street Journal. Currently, she co-leads a community-engaged, federally funded research team investigating the causes and consequences of rural jail incarceration. We also are lucky to have Dr. Sherman. She, her as well, is a professor of sociology at Washington State University. Her qualitative research focuses on poverty and inequality, mainly in the rural Northwest. She is the author of 2 books, 2019's Those Who Work, Those Who Don't, Poverty, Morality, and Family in Rural America, and 2021's Dividing Paradise, Rural Inequality, and the Diminishing American Dream. Her work has been featured in sources including the LA Times, National Public Radio, Politico, The Atlantic, The Guardian, and the Boston Globe. She served as president of the Rural Sociological Society from 2023 to 2024, and her current grant-funded research examines the drivers and impacts of rural jail incarceration in Washington State. I will turn it over to you both. Welcome, Dr. Sherman and Dr. Schwartz.
Thank you. Thank you so much for attending today, and to Tracy for inviting us. I'm Jennifer Sherman, and we are really excited to present to you about our project. So I want to start by just thanking our funders that include the Vera Institute of Justice, Arnold Ventures, and the National Institute of Justice for just supporting this work. I also want to thank our project coordinator, Rebecca Kastner, for all the hard work that she's done on this project, as well as the numerous grad students who've supported us over the years. So I'm going to start by just telling you a little bit about ourselves and the history of this project. The Washington Rural Jails Project really began in the summer of 2019 when the Vera Foundation of Justice announced a call for grant proposals to study the rise in rural jail incarceration rates relative to urban. So basically, while prison populations and urban jail populations were declining at this point for decades, by 2019, rural jail populations were on the rise and were 2.5 times higher than those of urban jails. The call to investigate this trend was nationwide, and they were basically looking for teams to investigate this question in specific state contexts. And at the time, incarceration honestly really wasn't on my radar. So I'm a rural sociologist, and I spent most of my career studying rural poverty and inequality, but generally more from the perspective of how deindustrialization and job loss in rural areas have impacted local populations. So when my focus on marginal populations meant that I had interviewed many people over the years who had criminal legal experiences, I can't say that I really knew much about criminal legal systems themselves. Like a lot of people, I didn't even really fully understand the distinction between jail and prison at the time. But after multiple people nudged me to submit a proposal for this grant, I started thinking about the connections that I could possibly make between my previous work and the question that the grant wanted to answer. So I reached out to my friend and colleague, Jennifer Schwartz, who, as you heard, is a criminologist with interests in multiple aspects of the criminal legal system, including trends in crime and punishment, as well as gender and crime, substance use and crime policy, and even rural-urban differences in offending. So together, we began to talk out the potential ways that we might approach this question, and we just realized that it was a potentially really exciting project for us if we collaborated. So not only did we bring different substantive expertise to the table, but different methodological toolkits as well. I'm a qualitative interviewer and ethnographer, and this allows me to really dig into individual understandings and experiences, while Jen is a quantitative statistician who can look at the big picture and uncover trends and patterns. And together, we designed the initial project, which combined quantitative statistical analysis of jail booking and release data with in-depth interviews with individuals who'd spent time in rural jails, as well as interviews and focus groups with folks who worked in them. And then the next step, and one that was a requirement of the grant, was to identify specific rural counties in Washington state whose systems we would investigate together. And even more difficult, we needed those groups to agree to participate in the project and actually contribute data to our efforts. So we began reaching out to sheriff's departments around rural Eastern and Central Washington. And we started by just writing emails and making phone calls. And we were able to secure some participation from a couple of sheriff's departments that way. But when most of them were really unresponsive, we realized that we needed to spend the time and energy to actually meet them face to face, be there in person, make those personal connections. So we hit the road and showed up uninvited at several jails and just asked to speak to the sheriff or jail commander, basically whoever would talk to us. And we also made multiple visits to WASPIC to present our proposal and chat with potentially interested stakeholders in person. And these in-person connections proved really invaluable to the project, and we quickly realized the importance of treating these research collaborations as ongoing relationships in which we tried to provide something of value in return for learning from our partners.
Yeah, so ultimately we secured participation from sheriffs and jail commanders in 6 rural counties in Eastern and Central Washington. These were Asotin, Ferry, Grant, Kittitas, Okanagan, and Whitman counties. And as some of you know, these county contexts are pretty distinct from the Western Washington in terms of population density, economic drivers, and political orientation. So sheriff's departments here cover vast expanses of really sparsely populated land, the largest being twice the size of the state of Delaware. And the landscapes are really varied with dramatic mountain ranges and passes and to miles and miles of desert scabland, which of course poses challenges to patrols and for transporting people to and from to jails. So people living in these contexts, in these rural contexts, tend to be poorer on average than the others in the state of Washington. And the communities, some have far fewer resources, economic and otherwise. And it's also not uncommon for people working in these counties to feel somewhat ignored or their needs neglected by those in the more densely populated urban areas on the west side where state government's located. So 5 sheriffs signed data use agreements with WSU to pull together their jail booking and release records for the previous 5 years or as were available, and they securely shared them with us. All 6 also agreed to participate in occasional virtual meetings where we discussed issues that were facing rural jails, as well as shared information and creative solutions with one another, which was really important because the pandemic struck soon after our project began. So even though it was a heavy lift for some of our jurisdictions to share their data and to spend time in meetings when they might have limited staff and time, we think what they found compelling was this opportunity to really address some of the shared challenges and share some of the successes that they had experienced that were related to rurality, to learn from their own data and from each other, and especially to highlight what's happening in their jails and communities, which can be misunderstood or stereotyped as resistant to change or lagging behind, despite facing structural constraints that aren't always recognized or making really great strides forward. So we're in, we think, a favorable position to do this kind of work because Washington State is a land grant institution, meaning that we have an obligation to serve and support our local communities. And community engagement is really core to the university's mission and to this project. So for our part, what we did was we analyzed the quantitative data, over 55,000 records in the first round of data collection. We conducted hours upon hours of qualitative interviews with now over 70 people who've spent time in one or more of our rural jails in our network. And we systematically gathered information and learned from our conversations with jail staff and legal actors. We've also toured nearly all the jails in our network. So we've presented some of these findings to state audiences to try to elevate the messages that and the findings that we have found. And we've made presentations to places such as Office of Public Defenders, AOC, the state's Jail Standards Task Force, and now here, as well as to national academic audiences like the American Society of Criminology and the Law and Society Association. And so what we learned and presented from the quantitative data, we learned that many initial and subsequent jail stays were due to a constellation of charges that we call system navigation problems. These mostly involved court non-appearances, which might trigger a warrant, as well as the inability to pay fines, non-compliance with court orders, such as getting a substance use evaluation, or driving on a suspended license, some of which maybe could have been reinstated with the know-how or with by paying off some moving violations. So over a 5-year period from roughly 2015 to 2019, prior to the pandemic, we found that over 40% of jail admissions were for one of these charges. And collectively, they used almost 250,000 bed days. System navigations accounted for the single greatest use of bed space, as you can see, compared to these other charges. And for those who re-entered jail, system navigation charges like failure to appear were far more common than for those who didn't re-enter jail. So in fact, more than half of jail re-entries were due to these system navigation problems. And we have more detailed findings posted on our website if anyone cares to look.
And from the qualitative interview data with those who'd been to jail, we also learned more about the reasons why people struggled to get to court and got those FTAs. So their issues range from things like just not getting court notices because they were sent to a former address or because they were homeless, but also transportation difficulties, especially for those whose licenses were suspended or who didn't have a working vehicle, which is a real problem in rural areas. There were also, people who just didn't know the right court date where there had been a continuance, or maybe they just weren't in communication with their defenders. And finally, we heard a lot about mental health issues that could make keeping track of obligations difficult for some of our folks. And we also learned a lot through our ongoing relationships with system actors, which we have continued through multiple phases of the project. So we provided data reports to the sheriff's offices and jail staff in the first phase of the project. And now in the second phase, we provide these to larger stakeholder groups in our network. When the initial grant funding ended, we applied for and received a 3-year grant from the National Institute of Justice to continue and expand the work we were doing. And in this second phase, we were able to hire a program coordinator who would help us hold a series of stakeholder meetings in each of our counties that involved jail staff, legal system actors, social service and healthcare providers, and we would come together to engage in data-driven collaborations and to bridge diverse perspectives and just address some of the issues that they have in common and promote change.
So through this grant work, we were able to pose some questions that were of importance to the sheriffs and jail commanders who initially described their jails to us as revolving doors, where many of the same people were entering and re-entering, or maybe could be found in a neighboring county's jail. They described the challenges of dealing with individuals who suffered from drug and alcohol abuse or mental health issues, while having no full-time medical staff, relying instead on part-time or contracted service or local hospitals and clinics. So routine care and managing the needs of those with chronic health issues, dental problems, or those who experienced medical emergencies often were accounting for a substantial share of county jails' budgets. For example, when someone who was incarcerated had to be helicoptered to access appropriate medical treatment. The aging jails that we visited sometimes had limited capacity to house medical facilities or equipment, which could be in small rooms, if at all. And secure medical carts, for example, for MOUD, weren't particularly well suited to some of the narrow hallways and many stairs that would have to be navigated. We were also told about limited personnel, both in terms of correctional officers and medical staff, who could provide medication-assisted treatment for substance use disorders or to manage those withdrawing from substances upon intake. So in the time we've been doing this work, several of the jails have adopted MOUD, some calling it a game changer. But they also describe how deputies and COs often have to administer this program, which takes a lot of time and coordination. And although most express interest in applying for grant funding, and at least one has been successful, those goals are often challenged or frustrated by lack of knowledge about how, the time it would take to do so, and more fundamentally by some of the requirements that couldn't be met. For example, using a particular computerized system, a record system that was incompatible with what their providers were currently using.
And in addition to collaborating with the jails, beginning in 2020, I started reaching out to community stakeholders who might interact with people who had exposure to the criminal legal system, including those who work in social services, health and mental health, and victim support services. And I was just interested in learning more about how our communities are supporting people once they've gotten out of jail and the challenges that they faced in providing this kind of support. And I was just, surprised by how much I ended up learning about the system itself and the communication gaps that challenged both jail staff and these local actors. So among the issues that were brought to our attention through these conversations were numerous gaps in our county's service provision. And they talked about lacks of support services for those who are released from local jails and the need for more outreach to those who are currently incarcerated before they're released. We also heard from our jails that they just wish there were more opportunities for warm handoffs to service providers upon release. And we heard from multiple sides about the need for improved communication between sheriff's departments, healthcare, and social services. We heard about a lack of resources, but also the need to cooperate and share those limited resources across different services and sectors. We heard about staffing shortages in all areas, including law enforcement and sheriff's departments, the judicial system, but also healthcare, mental health, addiction treatment, and other supportive services. In most places, there's a clear need for these services, both in the larger community and in the jails. And we've heard multiple explanations for the lack of local providers, and these include issues like high housing costs in a lot of our communities, as well as a lack of housing supply, but also just remoteness and low salaries in the communities compared to urban places. And I should note that a lot of these staffing issues are really nationwide problems and shortages, and that makes it even harder for these rural areas to compete for limited personnel. This awareness of the need for greater communication and cooperation across the criminal, legal, health, and social services sectors inspired the later phase of the project, in which we visit our communities and facilitate stakeholder meetings focused on identifying needs and finding collaborative solutions. Over the last few years, since 2020, we've had the opportunity to hold meetings with stakeholder groups in all 6 counties in the network, including, we've been to some of them twice, in fact, and this has included and involved over 100 participants. So the themes raised by the stakeholder groups echoed and extended upon a lot of what I was hearing about in those earlier one-on-one conversations. And the challenges they identified together included services for housing and homelessness, particularly for those with felonies, but also for victims of domestic and intimate partner violence. We heard a lot about employment and job training needs, as well as public defense and help navigating the criminal legal system. There's needs for anger management and family counseling, for mental health care, sober living and recovery facilities, and even just simply counseling people about how to talk to potential landlords and employers about their criminal records in thoughtful and self-reflective ways that might help them actually succeed in their job and housing searches. We've heard from really all of our communities about the stigma around things like low income and post-release housing, which can make it really difficult to find locations for siting this type of housing. They also voiced the need for public education and outreach around multiple social problems that are intertwined with criminal legal involvements. And we heard about all sorts of structural lacks that challenge people trying to get to court and to required services, including things like lack of transportation and lack of reliable internet service in many of our communities, as well as lack of modern court date notification systems. So in every community, we heard about the need for post-release support as well for those who've been incarcerated in jail, right? While such services exist for those exiting prison, there's really minimal support for jail release.
Well, despite these many challenges that we've kind of reviewed that are faced by rural communities and addressing some of the underlying causes of jail incarceration, we also wanted to talk about a number of strengths that they could and did draw upon. So for one, the stakeholders we met with were really deeply committed to their communities and to their work, often maintaining a hopeful and positive outlook despite facing some challenges. Personal connections were longstanding for some, so there was high trust, communication was easier or streamlined, and efficiencies were really possible. For newer folks in the community, there are fewer gatekeepers and bureaucratic barriers than in larger communities when trying to make changes or find the right individual to, with decision-making power, although it can take some time to build trust. We heard time and time again in our meetings about how people at the table talk to each other all the time, but also that their interactions are really centered around day-to-day issues rather than on a big picture, system-wide strategic approach. And we were told that it was useful to have someone dedicated to pulling together these types of groups, including those people who aren't necessarily in contact every day, and to have time to brainstorm and discuss new ideas, as groups can kind of fall into taken for granted ways of doing things. And so after our meetings ended, we often heard people introducing themselves to one another or following up on new ideas that were expressed during the meetings. And so that was really encouraging. Communities were really creative in solving local problems, sharing resources like office space or addressing staffing shortages by sharing trained professionals across jurisdictional boundaries or organizations, and really making good use of the resources that as they existed. Many people mentioned how it was harder for those who were struggling to kind of slip through the cracks because they were more easily seen in these smaller communities, and stakeholders could make a concerted effort to around an issue or initiative with really great effect. One person or a few trailblazers we've seen can make a really big difference in a small community.
There we go.
Okay. Yeah. So, as I was saying, we witnessed really the efficacy of local leadership in making big changes in criminal legal systems by marshaling resources and improving jail environments and living conditions and adding programs to address underlying issues. So I want to just highlight some of these small wins or incremental or sometimes large changes that resulted from our stakeholder meetings and really from the communities working together for people communicating openly, working in the collaborative spirit, and strengthening partnerships or developing new ones, and hopefully using some of the research on their legal systems and jail use and its impacts. So we just wanted to relay a few examples. So in one, a jail commander agreed to update online jail rosters more frequently because it would allow the medical clinic to continue Suboxone treatment for its patients and for recovery navigators and service providers to keep up with their clients.
Another group developed a plan to engage the wider community through social media to highlight success stories of those who'd been in jail but later succeeded in substance abuse treatment, to really humanize addiction and highlight the possibility of recovery, and to kind of boost the morale of correctional officers who often saw people at their worst and only saw those who returned rather than the ones who changed their lives and got themselves out of these cycles.
In another, community stakeholders made agreements to further coordinate their resources. For example, one organization would loan office space one day a week to a traveling clinician who could offer anger management and relationship counseling, but had stopped coming because they didn't have a place to practice.
And in another example of coordination, the courts and jail in one jurisdiction plan to share more information to prevent failure to appear warrants from being issued in other jurisdictions while an individual is in jail. And rather than transport people to other counties, they just tried to make greater use of remote court options to resolve rather than continue cases.
As a result of collaboration, one jail had plans to adopt tablets with resources such as GED classes. And, after the meetings, they decided to include more information about local social services, how to get licenses back, and some other reentry resources that would be helpful.
Another county plans to develop a one-page quick guide for those exiting jail with some simple steps they can take and services they can access, including how to find one's court date and get in touch with a public defender, as people are often overwhelmed by the mounds of information they get upon release.
Several of the counties highlighted this need for more second chance employers who hire those with a criminal record. So in addition to this longer term goal of targeting new businesses coming to the area as second chance employers, at least one county will circulate a list of second chance employers to organizations who will disseminate this information to those who need it.
And finally, in a promising approach, one county would like to use their data to focus on those who are struggling the most. They found that a relatively small number of people have numerous warrants or just visit the jail and other emergency services really frequently, and find that identifying those who could use additional support and addressing their underlying issues might make a sizable impact. And they thought recovery navigators might be the best ones to lead this effort.
So we want to talk for a minute about Recovery Navigator. So for those who may not have heard of the RNP program that began in around 2021 and funded through DSHS, Recovery Navigators are peers trained in addiction recovery and social services, and they work closely with people in jail or have been recently released and try to connect them with treatment, housing support, peer support, and other needs that they may have to otherwise reduce barriers to recovery and reintegration. And so peer counselors recognize that small towns can be judgmental, but also forgiving of those who strive to make amends and who earn the forgiveness of others. And their personal success stories can be really inspirational to others in the same community. So having been on the ground before and after this program's initiation and through our stakeholder meetings and interviews with those in rural jails, we've really seen and heard what a huge difference this program can make and what seems to be working best. So we wanted to highlight some of those practices that seem to be successful. So one is that referrals from jail staff who often know who can use the help have been really welcomed. Navigators in our meetings have highlighted the really important need to make connections with people while they're in jail rather than after release to establish a trusting relationship, and because it's a good time to intervene rather than post-release when people have many other things on their mind. So these early referrals and access to people in jail help to measurably to get people into treatment and to develop constructive release plans. Transportation is a really important part of the post-release plans, and providing transportation seems to be a big part of what some of the most successful RNPs have been doing. So this involves driving people sometimes really long distances to treatment beds, could be 1 or 2 hours away or even longer. And the intake process can be intensive into those centers and sometimes taking 4 hours or more. And the navigators will often stay to make sure that people are accepted into the facility. So it can be really challenging, especially when beds are first come, first serve, and clients are hours away. During this time as well, the RMPs are out of office or otherwise unavailable. But, a big upside of this is the opportunity to talk to people and bond with them and prepare them for what's coming next. So transportation generally can be a struggle, as we've mentioned, for those in rural areas with criminal legal involvements. And people often need to go to appointments or, to court to stay in compliance with their post-release conditions, or they might face return to jail. So RMPs have been really have been able to help ensure clients make their court dates by providing transportation, but also by knowing what they when they need to be there. So in one jurisdiction, for example, RMPs get the court docket 1 week ahead of time so they can communicate with their clients or via colleagues in transitional housing for those who don't have phones. And through an agreement with the prosecutor in this county, RNP clients' cases are heard first and in succession, one after the other, so that the RNPs can be more efficient with their time. Challenges, of course, remain, and there's a need for navigators who can help those who don't have a substance abuse problem, but nonetheless face mental health or physical health problems, domestic violence, homelessness, or other challenges to getting one's life back together after a jail stay. And so while these programs exist and have existed for people leaving prison, the state's reentry initiative could be further expanded to those exiting jails. And we're hopeful that it seems like it will be.
Okay, there we go. We think the importance of recovery and re-entry navigators is best conveyed by someone who has firsthand experience with it. And this is a quote that comes from a 41-year-old white man that I interviewed, who I gave the pseudonym Ezra. He said, well, the recovery navigator was visiting me in jail, and you know, she talked to me a little bit. So the day I got out of jail, she was going to help me get a ride or whatever and try. I was worried about coming back to a house full of drug addicts, you know? But instead, when I got out of jail, instead of walking anywhere else, I walked to her office, which may not seem like that big of a deal, but I could easily have made a left and walked to the drug dealer's house, who was right down the road too. But instead, I walked straight into the office and I talked to them. And I was like, well, fuck it. I'll go to inpatient today, right now. And she took me at my word. And the next thing you know, she was on the phone and found a place that took my insurance, and she drove me to the city 3 hours away that day. So as you see from Ezra, this kind of program that makes a personal connection with a peer counselor to help create a post-release plan has a lot of potential to affect positive change for those who face barriers to successful reintegration. And so to conclude, we've learned a lot from our work about the unique contexts and vulnerabilities of rural communities and systems and people. We think that this work is really important and valuable, and we're hoping to continue it into the future, even after our current grant cycle ends. So some ideas we're thinking about pursuing include possibly expanding the network into additional rural communities in Eastern and Central Washington, potentially adding tribal jails and communities into the network, and focusing on under-recognized social problems that drive jail admissions, such as addressing domestic violence more effectively in our communities. We also hope to continue working with our stakeholder groups while also facilitating their persistence as long-term community coalitions. And we also hope to keep learning more about trends in our jails, as well as the impacts of programs like RNP and new policies and initiatives at either the state or county levels. So we'll wrap it up there, but we're really looking forward to hearing your questions and comments. And thank you again for coming today.
Excellent. Thank you very much. Hey, do we have any questions out there for Dr. Sherman and Dr. Schwartz? I did put one question in there in the chat. So going to the jails and doing these interviews, you've identified some shortcomings, and you've seen what kind of stakeholders are out there to collaborate with. Just by you identifying issues and looking at the stakeholders, were you able to create relationships and start networks or coalitions just because of your involvement in this project? Like, jails weren't doing it before you guys identified the things, and now they are.
I wouldn't say that that's the case for all of our jails. I think there definitely were some communities that already had a lot of stakeholders working together and had different kinds of coalitions, but a number of them didn't have anything formal or organized. And yeah, this really was something that grew out of needs that a lot of them expressed, where they told us over and over again, like, we just need to communicate with each other. We just need to talk to each other. And we just thought, okay, well, that seems easy to do, but it takes a lot of energy. And that's where our program coordinator makes the enormous difference, is that she just has the time and energy to reach out to people, bring them all to the table, you know, and set this up, which sometimes it's really just the time and energy to organize that makes all the difference.
Okay, thank you. So if there's some jails that are interested in working with this pilot and who you haven't been, how would you recommend they get a hold of you or to express interest in working with you?
I'd say you could definitely email us and we'll put, our contact information, make sure that's available, that we have a website. If you can't find us, you can look up Washington Rural Jails Network through WSU. And we have a website there that gives us some information about what we found and the larger trends and things. But yeah, probably reaching out via email is probably the best.
Excellent. Thank you. Okay. Does anybody have any questions? Okay, I don't see anything in the chat. Somebody did ask, would these slides that you presented, would it be available for me to distribute to our network? That's a yes.
Yeah, sure.
Gotcha.
Yes. Yeah.
Okay, great. All right. Well, again, I want to thank you, Dr. Schwartz and Dr. Sherman, for agreeing to speak on this very cool project that you've been working on, and I look forward to collaborating with you in the future. Next month, we're going to be having the end of February, we're going to have our next presentation is going to be Olympic Health and Recovery Services, a comprehensive look at programming for the Thurston County Jail. And so they talk about having a treatment model that's actually built into the jail. And so they're going to be talking about the success that they've seen with that program. So with that, everybody, thanks again for joining us, and we'll see you next month. And this will be recorded, and I will send out the recording to everybody as well. So thank you very much, everybody. Have a great day, and we'll see you next time. Take care. Bye.